Hello everyone, this is Dr. Sam and this video is about Ovarian-Adnexal reporting and data system ultrasound. Ovarian-Adnexal reporting and data system ultrasound, or O-RADS US, is a system designed to classify ovarian and adnexal pathologies in ultrasound imaging. This system makes it easier to classify ovarian pathologies as benign or malignant. There are 6 categories in O-RADS, starting from 0 up till 5. O-RADS US 0 is given to an incomplete evaluation of the ovary and it requires further imaging. So an incomplete exam is O-RADS US 0. A normal ovary is given O-RADS 1. This is a normal ovary with ovarian follicles measuring less than 3 centimeters. A corpus luteum is also under the category O-RADS 1. It is a corpus luteum that is measuring less than 3 centimeters. This is a corpus luteum showing ring of fire sign on color doppler. O-RADS 1 indicates a benign condition with no follow-up necessary. All functional cysts, such as follicular cysts, fall under O-RADS 1 because they are due to physiologic changes in the ovary. Now we move on to O-RADS US 2. This includes findings that are benign with almost 0% risk of malignancy. A simple cyst that measures between 3 to 5 centimeters comes under O-RADS 2. A simple cyst will be thin-walled and anechoic. It will be unilocular, which means it has just one chamber or one compartment. It will have posterior acoustic enhancement. This bright area is the enhancement. It will not have any internal echoes or solid components. No internal flow will be seen on color doppler. If the measurement of this simple cyst is between 3 and 5 centimeters, then for premenopausal patients, no follow-up is required. For postmenopausal patients, a 1-year follow-up is required. If the simple cyst measures between 5 and 10 centimeters, then premenopausal patients require 8 to 12 week follow-up and postmenopausal patients require 1-year follow-up. This is not a simple cyst because it has a partial septation, so this will be a complex or a non-simple cyst. It is a complex unilocular cyst with smooth margins. This type of cyst also falls under O-RADS 2. If this cyst is less than 3 centimeters, then premenopausal patients do not require follow-up, but postmenopausal patients require 1-year follow-up, and MRI is recommended as well. But if this cyst measures between 3 and 10 centimeters, then premenopausal patients require 8 to 12 week follow-up and referral to a gynecologist, and MRI is recommended for postmenopausal patients. A hemorrhagic cyst measuring less than 10 centimeters will fall under O-RADS US 2. A hemorrhagic cyst has lace-like internal echoes. These reticular internal echoes are seen within a hemorrhagic cyst. These are due to clotted blood. No internal vascularity will be seen on color doppler. This cyst will have posterior acoustic enhancement. A dermoid cyst is a cyst that contains teeth, hair, brain tissue, or fat. Usually they are benign. A dermoid cyst that measures less than 10 centimeters falls under O-RADS US 2. They have variable appearances on ultrasound. The appearance depends on the type of material found within the dermoid cyst. Dental structures usually appear hyperechoic and have posterior acoustic shadowing. This dot dash pattern is called dermoid mesh. This appears due to the presence of hair. Dermoid cyst will have no internal vascularity on color doppler. Echogenic floating structures may also be seen within some dermoid cysts. They could be either fat or even brain tissue. An endometrioma, which is also known as chocolate cyst, is a unilocular cyst with homogeneous internal echoes which give a ground glass appearance. An endometrioma measuring less than 10 centimeters falls under O-RADS US 2. This is another image of an endometrioma. We can see a unilocular cyst with homogeneous internal echoes, and it gives a ground glass appearance. A para-ovarian cyst is found outside the ovary and is usually next to the ovary. It will be a unilocular anechoic cyst separate from the ovary. If the para-ovarian cyst measures less than 10 centimeters, it falls under O-RADS 2. Peritoneal inclusion cysts that measure less than 10 centimeters also fall under O-RADS US 2. This cyst is anechoic with septations. These internal walls are the septations. This cyst is also found next to the ovary. It does not have a well-defined border. Due to these septations and its position being next to the ovary gives a spiderweb pattern. Hydrosalpinx is the term given to dilated fluid-filled fallopian tube. On ultrasound, a normal fallopian tube is not visible. But when it is dilated and filled with fluid, it is termed hydrosalpinx. The fallopian tube will appear anechoic, dilated, and it will have a sausage-shaped appearance. Sometimes it also has a C-shaped appearance. A waist sign is a feature of hydrosalpinx. The dilated tube appears pinched or constricted in the middle, resembling the shape of a waist. This small protrusion on both sides of the wall of the fallopian tube is the waist sign. In a transverse view of the dilated fallopian tube, a cogwheel or gear sign is seen. This wall irregularity of the fallopian tube are due to the folds within the wall, which gives a cogwheel-like appearance. Hydrosalpinx falls under O-RADS 2. These findings are benign with almost 0% risk of malignancy. O-RADS 3 includes lesions with features suggesting a low risk of malignancy, that is a 1 to 10% chance of malignancy. A multilocular cyst that measures less than 10 centimeters comes under O-RADS 3. A multilocular cyst has more than one compartment or chamber. You can see within this cystic lesion There are multiple chambers or compartments. This is a multilocular cyst. An example of a multilocular cyst is a serous cystadenoma. It is a multilocular cyst without solid components. There is either no or minimal internal vascularity on color Doppler, and it usually has smooth inner wall. A serous cystadenoma usually comes under O-RADS US 3. Color score refers to the amount of vascularity seen using color Doppler. Color score 1 is no blood flow, no vascularity seen. Color score 2 is minimal blood flow. Color score 3 indicates moderate blood flow. And color score 4 is intense hypervascularity or marked blood flow. This multilocular cyst has two compartments. It has smooth inner wall, and on color Doppler, moderate vascularity is seen. So that is a color score 3. Multilocular cystic lesions with a color score between 1 and 3 and measuring less than 10 centimeters will fall under O-RADS 3. A unilocular cyst that measures more than 10 centimeters will fall under O-RADS 3. This includes both simple and complex cysts. If they measure more than 10 centimeters, the category will be O-RADS 3. Hemorrhagic cyst, dermoid cyst, endometrioma, paraovarian cysts, and peritoneal inclusion cysts measuring more than 10 centimeters will fall under O-RADS 3 due to their large size. This image shows a large endometrioma exceeding 10 centimeters. So this endometrioma will fall under O-RADS 3. A unilocular cyst with irregular inner wall falls under O-RADS 3. This wall irregularity must measure less than 3 millimeters. This measurement should not exceed 3 millimeters. These small protrusions into the lumen of the cyst are wall irregularities. For O-RADS 3 lesions, referral to a gynecologist and MRI are recommended. Now we move on to O-RADS 4, which includes lesions that present a moderate risk of being malignant. That is a 10 to 50% chance of malignancy. This category includes a unilocular cyst with 1 to 3 papillary projections. Papillary projections are these protrusions into the lumen of the cyst. These papillary projections must measure more than 3 millimeters. If they are less than 3 millimeters, they will be known as wall irregularities. So this case has one papillary projection. It measures more than 3 millimeters. This was a case of serous cystadenoma. Color score does not matter in this type of lesion. This type of lesion can have any color score, and it will be categorized as O-RADS 4. This is another unilocular cyst with 1 to 3 papillary projections. It is a unilocular cyst as it does not have any septations present. No compartments or chambers are seen. We can only see the papillary projections. So this type of lesion will fall under O-RADS 4. This is another case of an O-RADS 4 lesion. This is a serous cystadenoma with papillary projections. There is one papillary projection seen. and the cyst has a single chamber, so it is a unilocular cyst with 1 to 3 papillary projections, and it is an O-RADS 4 lesion. A multilocular cyst with solid components also falls under O-RADS 4. An example of this type of lesion is mucinous cystadenoma. This is a multilocular cyst. We can see septations within this cyst. This is a septation. So these are different compartments. And the cyst gives posterior acoustic enhancement, so it is not a completely solid lesion. It is a complex cystic lesion, and it has solid elements. These are the solid components. So this is also an O-RADS 4 lesion. This is a multilocular cyst without solid elements. We can see the septations and multiple compartments, but we do not see solid areas other than the septations. But another feature to note here is the irregular inner wall. There is wall irregularity in this multilocular cyst without any solid components. So this type of lesion also comes under O-RADS 4. This is also a multilocular cyst without solid elements, although it has smooth inner wall, but it is a large lesion. It is exceeding 10 centimeters. Because of its large size, this multilocular cyst without solid elements and smooth inner wall will fall under O-RADS 4 because it exceeds 10 centimeters in size. A smooth, well-defined solid mass also falls under O-RADS 4. An ovarian fibroma usually appears as a smooth, solid, well-defined mass which can have a color score of 2 to 3, that is a minimal to moderate internal vascularity. So any solid smooth mass will fall under O-RADS 4. This is another image showing a solid smooth mass with moderate vascularity on color doppler. This is a well-defined solid mass. It was also an ovarian fibroma. This is an O-RADS 4 lesion. For O-RADS 4 lesions, a referral to a gynecologic oncologist is advised and MRI is recommended. O-RADS 5 includes lesions that are highly suggestive of malignancy with a greater than 50% risk. This includes a unilocular cyst with 4 or more papillary projections. Here we can see 4 papillary projections in a unilocular cyst. So this is an O-RADS 5 lesion. A multilocular cyst with solid elements also falls under O-RADS 5. This is a large multilocular cyst having large solid components. It is a mixture of cystic and solid lesions. So this is also an O-RADS 5 lesion. Their color score is usually 3 to 4. That is a moderate to intense vascularity. This is another multilocular cyst with solid components. These are the locules, and these are the solid components. They show intense vascularity on color doppler, so this is a color score 4. This is another multilocular cyst with solid components. It also includes papillary projections and very high vascularity. This is a color score 4 vascularity. All these features indicate an O-RADS 5 lesion. A solid mass with irregular contour also falls under O-RADS 5 because a mass with irregular borders is highly suggestive of a malignant lesion. It has moderate to intense vascularity on color Doppler. This was serous ovarian carcinoma. Carcinomas come under O-RADS 5. It also includes clear cell carcinoma. Any solid mass with irregular contour and a color score between 3 and 4 will fall under O-RADS 5. If ascites is present, along with an ovarian tumor, or if there is peritoneal infiltration, this type of appearance is classified as O-RADS 5. For O-RADS 5, referral to a gynecologic oncologist is recommended and MRI is recommended as well. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.